Well, good evening, everyone. Thank you for joining us for this final board meeting for this term of council for public health. And I appreciate you joining us this evening, even if, it's your first one or last one. But we do appreciate all the participation that does happen in this forum on a regular basis. And once again, we're here this evening for the last time for this board term of council. Anyways, there are no ceremonial activities for this evening, and so I'll pass it over to the board secretary for the roll call, please.
Thank you, Mr. Chair. Member Chernyshenko? Present. Member Fleury? Member Kapoor? Present. Member Lakin?
Présent.
Member McKinney? Member Pinel?
Présent.
Vice-Président Poirier? Member Chair Kadri, sorry.
Present.
Member Kakish?
Present.
Member Taylor?
I am here.
Member Tilley?
Present.
You have quorum, Mr. Chair.
Thank you very much. And moving on to the rest of the agenda, declaration of pecuniary interest, both from this meeting or previous meetings. Any declarations? Seeing none. Confirmation of minutes. Confirmation of minutes for the meeting of September 17, 2018. Can we carry those? Thank you. Communication, there are 15 pieces of communication that we've received and are held with the Board of Health Secretary. So can we receive those communication pieces? Received? Yes. Thank you. Motion to introduce reports. Member Taylor, please.
Be it resolved that the verbal report by the Chair of the Board of Health, the verbal update by Dr. Vera Etches, it says Acting Medical Officer of Health. I think we've passed that. That was written by the acting scribe of the, and the report's titled Building a Healthier Ottawa, Ottawa Public Health Strategic Plan 2015 to 2018 Final Report, Medical Officer of Health Submissions to the Province of the Smoke-Free Ontario Act 2017 and the Cannabis Act 2017 and 2019 Ottawa Board of Health meeting schedule be received and considered.
Carried. So moving on with the consent agenda, Chair of the Board of Health verbal report. As usual, we'll hold that item. Item number 2, which is the Medical Officer of Health verbal report, and we'll hold that one also. Item number 3, Building a Healthier Ottawa, Ottawa Public Health Strategic Plan 2015 to 2018, final report. And as there's a presentation, we will hold that. Medical Officer of Health, item number 4, Medical Officer of Health submission to the province on the Smoke-Free Ontario Act and Cannabis Act for 2017. There is no presentation on this item. Anybody have any questions or comments? Seeing none, can we carry the item? Thank you. Item number 5, Ottawa Board of Health meeting schedule for 2019. There was a schedule provided. Can we receive that report, or do we have questions? Carried? Carried. Thank you. So moving back to item number 3, item number 1, which is my verbal report. Good evening. Bonsoir. This evening, I would like to highlight OPH's role and hard work as part of the broader city response to the tornado that affected several of our communities in September. Update you on the 2018-2019 Flu Immunization Clinic and highlight a seasonal influenza campaign event that took place on November 1st at City Hall. What's going on here? As you will recall, on September 21st, a series of powerful storms swept through the Ottawa-Gatineau region. Environment Canada confirmed a tornado moved through Ottawa's Arlington Woods neighborhood, and another one hit the community of Dunrobin. On September 22nd, Hydro Ottawa reported a multi-day restoration as more than 170,000 customers were affected by widespread power outages. Our dedicated public health team, including inspectors, nurses, physicians, and communications IT, and administrative support professionals collaborated with other city department colleagues as well as community stakeholders throughout the response and continue to do so in the recovery stage. I would like to acknowledge these dedicated professionals for their work and commitment in ensuring Ottawa residents receive the information and support they needed. OPH staff created a centralized content web page at ottawapublichealth.ca/tornado and echoed these important messages on all our social media channels and communication platforms. Topics included food safety and security during power outage, mental health resources, and how to protecting your health during cleanup efforts. Working with the Hospital Emergency Planning Committee of Ottawa, HEPCO, and OPH communicated with long-term care and retirement homes and supported physicians and healthcare providers regarding vaccine cold chain requirements. OPH staff were at the emergency reception and lodging centers and community support and service shelter centers to care for and comfort Ottawa residents. 2,700 plus hours of OPH employees' time was dedicated to the storm response. In addition, a specialized group of OPH members, city partners, and community stakeholders came together to create the Vulnerable Person Task Force, which included going door to door to check on residents in our most affected communities. OPH now participates in the After the Storm table as well as working with the United Way, community health centers, and community resource centers in affected areas as we recover as a city. On behalf of the Board of Health, thank you for all that you have contributed. Next, I would like to announce that as of today, now November 19th, Ottawa Public Health has completed its 10 community flu immunization clinics and 5 hospital-based clinics. OPH is also collaborating with community health centers to provide 23 outreach flu shot clinics for residents in group homes, shelters, and resident care facilities. Overall, attendance increased by approximately 30% from last year, largely attributed to older adults and families with younger children. OPH has provided more than 5,800 doses of flu vaccine in the past 5 weeks, compared to just over 6,900 doses in total of 2017-2018 season. For those who missed the clinic, the flu vaccine is still available through family physicians, participating pharmacies, and for families with children under 5 years of age. It is available by appointment at our immunization clinic located at 100 Constellation Drive, and this will continue into the new year. Lastly, OPH officially kicked off the seasonal influenza vaccine campaign on November 1st at City Hall. On that day, I joined Dr. Vera Etches, Mayor Jim Watson, Federal Health Minister Jeanette Petitpas-Taylor, Chief Public Health Officer of Canada, Dr. Teresa Tam, Director of Practice Advancement and Research of the Canadian Pharmacists Associations, Mr. Phil Emberley, and many medical officers of health from some of Canada's biggest cities who were in town for a conference. This launch event brought together some of Canada's prominent health officials. Pages are sticking together here, sorry. To highlight the importance of annual flu immunization to protect ourselves and to those who may be at higher risk of complications from the flu, such as elderly patients or grandparents, infants, and young children. A special thank you to OPH nurses Danielle Charbonneau and Diana Romero, who were on hand to provide the minister and other attendees with their influenza vaccine for the year. In closing, as this is our last Board of Health meeting for this term, I would like to thank all of you for your contributions over this past term and your commitment to public health in our community. It has been a pleasure and an honor to have served with you on this board. And that concludes my verbal report. Any questions or comments? Seeing none, can we receive the report? Thank you. Now over to Dr. Etches for your report, Doctor.
Thank you, Chair. With regard to influenza, I want to take this opportunity to highlight that we have hit the 100th anniversary of the Spanish influenza of 1918 to 19. It's not a happy event, but it's worth remembering. It led to about 55,000 Canadians dying. And unusually for influenza, most of the people who died, well, many, there was a higher death rate among people between years 20 and 40 years of age, in addition to the impact that we usually see on infants, toddlers, and older adults. The influenza pandemic had social impacts on families and on the workforce, and it also contributed to the development of public health in Canada. So the Federal Department of Health was established following the pandemic in 1919. And locally, on the ground here in Ottawa, it was public health nurses and others that were involved in responding to and trying to contain the pandemic. There were many community volunteers who also worked tirelessly and put themselves at risk when there were families who couldn't care for themselves. Going back to November 23rd, 1918, the Globe and Mail reported that 570 people had died in Ottawa during the pandemic to that date. And that would be a death rate of 548 per 100,000. So that compares to last year's flu season here, also in Ottawa, where there were 34 reported deaths, and that death rate of 3.4 per 100,000. Now, both are likely underestimates because, reporting due to influenza deaths would have been imperfect in 1918, and today we also only have the lab-confirmed count and people who may have been in an outbreak of influenza who died. But the reduced rate of death and serious illness from the flu over that century is a testament to improved health and public health systems, including access to influenza vaccine, as well as improvements in social conditions. Still, the 1918 pandemic is a reminder and a warning to us about the negative impact infectious disease can have on our population. Il est important de maintenir la capacité de santé publique afin de lutter contre les maladies infectieuses. Now, thinking ahead to the beginning of next month and World AIDS Day, also an infectious disease, on December 1st, and the Aboriginal AIDS Awareness Week, you each have a red ribbon in front of you, I think. You've got them there. Je vous encourage de porter le ruban pour montrer votre soutien aux personnes vivant avec le VIH et en souvenir de ceux qui sont décédés. So I encourage you to wear that red ribbon in memory of people who have died as well as people who are living with HIV. And the campaign this year is called Rock the Red Ribbon. So there you go. Chair, I would like to then now provide some updates on the new provincial cannabis legislation on OPH's role since legalization, the new consumption and treatment services guidelines, and the Urban Public Health Network meeting recently held in Ottawa. So with respect to cannabis legalization, Ottawa Public Health launched health promotion campaigns using blunt fact and toke joke taglines to provide the public with information on cannabis and how it can affect their health. Since September, the campaigns have reached over 160,000 people, residents in Ottawa, through social media, and the campaign advertisements have resulted in over 8,000 views of our cannabis information web pages. We've received multiple requests for presentations from a variety of community organizations demonstrating that Ottawa Public Health is seen as a credible source of information on cannabis. And we've collaborated with local treatment services, so including Service Access to Recovery, Rideau Wood Addictions and Family Services, and Maison Fraternité to provide social media promotion of their services in order to increase residents' awareness of where to go for help with problematic cannabis use. De plus, Santé publique Ottawa a collaboré avec les 4 conseils scolaires d'Ottawa pour offrir des séances d'information aux parents francophones et anglophones à travers la ville, touchant ainsi près de 400 parents. The information sessions provide parents with information and tips on how to talk early, talk often, and talk openly about cannabis. Ottawa Public Health developed a youth resource as well as information for parents and teachers, and it was provided to all 4 Ottawa school boards. So in late October, the Ministry of Health and Long-Term Care announced a new way forward for supervised drug consumption, following the Minister of Health and Long-Term Care's review of supervised consumption services in Ontario. We are encouraged that the provincial government review showed how vital these services are to people who use drugs as well as communities, and especially in the context of an opioid crisis. So under the new consumption and treatment services model, Ottawa Public Health is ready to work with the government to continue to develop integrated and seamless services for people who use drugs, to connect them to substance use and treatment services, mental health services, or the social supports that they might need. So therefore, we're currently working with the ministry as well as other service partners who provide consumption services in Ottawa to look at the next steps in reapplication to provide a new consumption and treatment services model. On November 1st and 2nd, Ottawa Public Health hosted the Urban Public Health Network meeting in Ottawa, which does involve the medical officers of health from 21 of Canada's large urban centres sharing best practices in public health. Travaillant en collaboration et d'une voix collective, le réseau s'attaque aux problèmes de santé publique communs aux populations urbaines. And some topics of discussion were strategic planning, the Canadian drug strategy, healthy cities, violence, and climate change. And so in conclusion, as this is the last scheduled meeting of the current Board of Health, I too would like to express it's been a pleasure to work with all of you. And on behalf of Dr. Israel Levy, I'm sure, and all of Ottawa Public Health, we have really felt your support. We support of the chair especially. We really know that you care about public health and you care about the employees of Ottawa Public Health. Thank you, Chair. Thank you to our Vice Chair, who's not here, and to all of you. Vous avez fourni une leadership stratégique pour améliorer la santé de notre population. Merci. And that concludes my report. I'm happy to take any questions.
So any questions for Dr. Etches? Any comments? Peter?
Just on the cannabis legislation piece, I think we did a great job over the last couple of years educating, submitting our concerns and expressing our concerns, and I guess the general sentiment was this was coming in no matter what. It was in October 17th it did. I'm wondering, Dr. Etches, it's probably more a Health Canada lead on this, but I'd just like to know if the plan is in place in a year or two from now that there will be people measuring, you know, where the standards are. I think some of the most recent reports I saw were around 2012 to 2015 as far as cannabis use percentage amongst the population. So they're looking at the age groups of 15 to 24, 25 to 44, and 45 to 64. I'd be interested if somebody will be measuring in a year or two from now the increase there with the legalization, but more I'd be interested in amongst youth that are below the legal limit, the legal age limit, where I'd like to see that. And then, of course, although the cannabis disorder percentages are very low, I'd be interested to see in a year or two that. And I don't know if that's a role for Ottawa Public Health amongst our population, especially youth, high school youth. But certainly I'd be interested in that cannabis disorders, because that's where it goes beyond recreational, becomes more into the field of addiction, where it's causing disruption in families and amongst the individuals. And I just don't know if that's only a Health Canada initiative or if that would be something Ottawa Public Health could be surveying, so we have a then and a now in a couple of years from now, because I'd just like to see I think consumption usage will increase, and I think I just hear from people I know in my generation in the 50s who have never tried marijuana or are now planning to or have, that it's legal. So I'd just be interested in following that and see how much of that could lead to those who are now suffering from substance abuse issues.
Certainly, thank you for the question. The surveillance of what's happening with cannabis use in our population, including among youth, is a key part of our strategy to look at mitigating the harms due to cannabis. So we have a number of different data sources that we draw on. So we do have pre-legalization information from the Ontario Student Drug Use Survey. I'm looking up in case anyone from the team who knows more wants to add or contradict me. And we also have information on adult use from the Canadian Community Health Survey. There are a lot of people looking at supplementing these sources of information to get more detailed information about patterns of use. And so, in fact, it was one of the subjects at the Urban Public Health Network meeting. How can we collaborate to strengthen our surveillance systems to be able to look at different nuances of use? And but you're right that the youth use is of top importance and of interest to the population. So we will have local Ottawa-based data, and we will compare that to other jurisdictions.
Great. Good to hear. Thank you.
Anyone else? Councillor Taylor?
Thanks very much, Mr. Chair. And I guess I would just say that we're now 7 months away from edibles becoming legal. And so as we kind of approach that next big, I don't know what it is, obstacle, wall, whatever it is, I guess I'd just be interested in knowing what the department's kind of plan is with respect to that, because here we're getting into a space that's probably a little more challenging for us to navigate, at least with cannabis consumption via the smoked product. We kind of had the Smoke-Free Act to fall back on, and we had an existing set of regulations to fall back on. But as you know, governments across North America, including here in Ottawa, while we've made some great efforts with respect to trying to limit marketing to kids, particularly sugar marketing to kids, controlling the food industry is a lot different than trying to control a controlled substance industry. So I'm wondering what your thoughts are, Doctor, on how OPH can try and position itself so that we get ahead of the edibles wave.
Thank you. We will continue to use the overarching strategy to promote a public health approach, which means using surveillance information, basing it on evidence, restricting access, using health protection measures as we can, and making sure people have information to make informed choices. You're right, the legislation still has to be written, and so we'll continue to do what we have done, which is to provide a public health perspective in the consultation periods. We asked the provincial government already to make sure that they include us early in the conversation about edibles. I think you can imagine the pattern based on our input to date would be to try to limit marketing. And I would say also, we're going to be reviewing the evidence, but looking at limiting the products available would be ideal. So we don't need a lot of different food products. There could be limits to the kinds of food products produced that we might want to recommend from a public health perspective. And I think working with partners is going to be important. If it's federal legislation, we need a unified public health voice across the country. If it's provincial legislation, again, we'll be working with partners who are aligned with a public health perspective to try to have a stronger voice together.
Thank you.
Anyone else? Oh, just a comment back to on Member Taylor's question about the edibles. And the edibles in this case, obviously, the retailing of those edibles is going to be an issue. And, my concern is, and will continue to be, is how do we as a provincial government put that piece of puzzle together? I mean, edibles in a grocery store, just like liquor in a grocery store, is almost wide open unless, somebody's out there checking IDs and age groups. The other piece to that for me is what size of a store will accommodate the edibles? Is it going to be the 60,000 square foot type of grocery store that's going to be doing that? Or is it going to be your local mod park convenience store? So that's something I think that we need to look at also as a public health to see the avenues of distribution, how large they will be, where will they be situated, and all of that piece of information has yet to come. But I just want to make sure that public health, at least in the Ottawa area, is looking at that and going forward to say, here are some advisements that we want to put into play going forward.
Yeah, it doesn't give us very much time between the legalization of non-edible products to learn from that retail model. There isn't a lot of research evidence about different retail models. We know that access makes a difference, and the promotion makes a difference. So we can extrapolate to the retail models for edibles based on what we've already put forward. But it would be nice to be able to add from experience. So what are we seeing with the legalization to date? So we will gather what information we can from across the country of what's happened so far when we're advising about the model for edibles.
Thank you. Anybody else? Dr. Kapoor?
Thanks. First of all, thanks to you, Dr. Etches, and to the OPH staff for all of the hard work over the years, trying to provide us with information and that we require, and for following the instructions we give, even when they're sometimes a bit hard, difficult. And I do appreciate the efforts and the dedication of the OPH staff. So please pass that along. The other change that came about with the new government's regulations and laws was about freeing up advertising, especially on e-cigs and vaping. And I'm not sure what leeway we have, what the City of Ottawa would have in terms of influencing the advertising, either in the cannabis shops or just with vape products in more general on those in there. And I'm wondering what work we're able to do with the city bylaws and other staff to influence those advertising. It was a long and hard-fought battle to deal with it in terms of tobacco, and it's a bit disheartening to know we'll have to do it again here. So I'm just wondering where things stand in terms of working with the city to make an influence on that and on the plans for retail cannabis when they're allowed in the spring.
Sure, thank you for the question. Those are active conversations right now. Jillian Connolly's leading for Ottawa Public Health with the city, and so certainly the retail model is under discussion. We expect that there was a public consultation survey done by the city, and they're looking at that information. They're looking at public health inputs into that. They'll be bringing that conversation to council, we expect, in December, because the council will have to make some decisions about retail by January 22nd, I believe. So part of that discussion, I understand, is looking at gaps in what was recommended by public health, what's good for the population, and maybe what the regulations provincially hold right now, and whether the city can address them. So that's work that is being undertaken with our input right now.
Thank you. Member Taylor?
Thanks very much. Sorry, just an aside, and it just popped into my head. I had a question a couple of days ago that I never put to you by email, so now's as good a time as any. As I've been driving to work this past week, I've noticed over and over there's a giant billboard advertising the Cannabis and Hemp Expo next week at the Shaw Centre. And I went and looked at their website of exhibitors, and of course they're all cannabis companies. There's nobody on there, with a public health lens. There's no, kind of responsible consumer type booth type of thing. And I know this would likely involve buying a space, and attending, but I know we often do that at places like concerts and fairs and festivals where there's going to be a concentration of activity, of behavior, where we might want to say to people, think about responsible consumption kind of thing, think about the health impacts. Not suggesting we go rain on their parade, but just food for thought that if we hadn't given any thought to this, we may want to think about attending the Cannabis and Hemp Expo, or at least checking it out and seeing what, seeing the kind of level of discourse that's happening.
Great idea, thank you. We'll take that back. Looking at Jillian taking notes. We may well actually already have somebody signed up to be there, I'm not sure. So we don't, but yeah, we'll look into that. I think there's always opportunity in dialogue and conversation. It's important to be able to understand different perspectives, so it would be good. And we have been engaging with industry, so maybe we're not signed up to join this expo, but we have been reaching out to the cannabis industry, to producers, looking at what we can learn, how they're operating, and as we do with alcohol, and we try to promote lower risk drinking guidelines, we're talking to the industry about cannabis lower risk use guidelines and how are they promoting them and where can they be. So we'll continue that conversation.
Anyone else? Seeing no other questions or comments, thank you very much, Dr. Etches, for your presentation. Can we receive her presentation? Received. Thank you. So moving on to item number 3, Building a Healthier Ottawa, Ottawa Public Health Strategic Plan 2015-2018. And this is the final report, so I'll turn the floor back over to Dr. Etches.
Now I'm wishing I turned it over to Jillian because you're just going to hear my voice more. But on behalf of all of Ottawa Public Health and certainly recognizing Dr. Israel Levy's leadership again, I just want to take the opportunity to say, well, 3.5 years ago, you approved a strategic plan for Ottawa Public Health, and here we are tonight to be able to look at how that plan helped us have a healthier population. And so I'm on to the next slide, which is to say that you approved the 5 strategic areas of focus, and then we went on to look at specific initiatives under these areas of focus. And so tonight I'm going to just really touch on the key highlights and accomplishments. There's more detail in your report. So first of all, looking at healthy eating, active living, we together expanded healthy eating, active living guidelines. So you probably remember it started with licensed childcare, home childcare centers, and we expanded that to after-school programs, retirement homes, and shelters. We piloted good food corner stores to improve access to food that's healthy, and we partnered there with the Canadian Convenience Store Association, Just Food, McEwen, Quickie stores in 8 corner stores. We continued to use the nutritious food basket data to advocate for adequate income so that people can actually buy the food they need. We worked with the Ontario Dietitians in Public Health to create that information, and we know that food banks, community health resource centers, the Good Food Initiative Steering Committee are some of the partners who've used that information. We worked with Safer Roads Ottawa, which includes police, paramedics, and our transportation department, to collaborate on promoting cycling safety and walking safety. And when it comes to those subjects as well, the partnership with school principals and the Ottawa Student Transportation Association and Enviro Centre were important to promote walking safety around 90 schools who had an assessment completed. And lastly, we produced videos that informed people about how the built environment affects their health, and it encouraged participation in planning discussions. This was undertaken with the Planning Department, with Clean Air Partnership and the Ottawa Community Foundation, as well as Carleton University and their Health Sciences Department. So next, to foster mental health. We found that Have That Talk campaign, the video series with facilitator guides, had a broad reach and appeal, and it worked to reduce stigma and address awareness of community resources for mental health. This work was supported by the Canadian Mental Health Association and the city's Health and Wellness Department. We're now up to 1.4 million views. We produced the first ever comprehensive mental health status report, and it was informed by an advisory committee of partners such as Wabano, the Royal, CHIO, the Vanier Centre, Community Services Centre, the Ottawa Local Immigration Partnership, the University of Ottawa, and YSB. Again, data was the start of a conversation around alcohol, and we went further to collect input from community members and about their experiences to continue the dialogue about how we can decrease harms from alcohol in our community. The Ottawa Hospital, police, paramedics, the Alcohol and Gaming Commission of Ontario, and the Ministry of Transportation were partners in that work. We also looked at many strategies here. When you think about decreasing the harms from opioids, there were prescription opioids where we partnered with pharmacies, especially Respect Pharmacy was a key pharmacy partner when it came to naloxone training. And we know that we had many different partners around supervised consumption, but in the early days, we were informed by Overdose Prevention Ottawa. We had the support of Sandy Hill Community Health Centre to open our site, and inner city health support as well. Not to press the point too much, but data and the EPI team, again, were key to our response to opioids, developing a new surveillance system drawn on paramedics data, coroner data, and Ottawa Police Services data. Lastly, on the topic of mental health, I wanted to highlight that we did advance the conversation about suicide in our community, making within the city the Safe Talk program accessible and some further guidance for people in the workplace. And then in the community, expanding knowledge and mobilizing others through a network called the Suicide Prevention Ottawa group, which has 55 different agencies as members. The Royal was key. Canadian Mental Health Association, school boards, and police. On our infectious disease priority, community health centers, the YMCA, shelters, and group homes were part of our work to decrease barriers to immunization for populations that had more difficulty reaching, becoming immunized. And we had a lot of work that went into our strategy to ensure that we have up-to-date immunization records for all children, not only attending schools, but also licensed child care centers. So school boards, child care centers were important there, but also we partnered with the Ottawa Hospital Research Institute, initiative, where we had their work to look at the use of an app, the Can Immunize app, which I believe is on the screen there. We are finding that we had 300,000 records to review every year or more, and we had last year seen a 40% reduction in suspensions that resulted from that more complete records, and this year it's even further reduced. So we don't have the final data in, but it's an excellent trend in decreasing suspensions. We launched the Ottawa Public Health Sexual Health Strategy, and there we reoriented clinical services to meet the needs of priority populations. We had a process of really deliberate client and community engagement, including partners such as Gay Zone Advisory Committee and the AIDS Committee of Ottawa. And lastly, our internal capacity to respond to infectious disease was increased through a surge response team that was activated many times, and we strengthened the capacity of our infection prevention and control team, as well as the supports to healthcare providers that are available to help them uphold infection prevention and control practices, and that partnership there was with Public Health Ontario. So next, in developing an adaptive workforce for the future, we launched a digital health strategy. City IT department was a key partner, and now we have a new website. We're chatting with clients, and we are well underway with process mapping to look at how we can have more efficient practices through an electronic public health record. The board, you, approved a reconciliation action plan, and this was key and supported really a priority of Indigenous cultural safety training for our employees as a key skill, and I can say that over 25% of employees have now participated in some training, including our entire senior leadership team. We've also advanced other learning and development of opportunities for areas where we see a need to continue to make progress into the future, such as on evidence-informed decision-making and leadership development. And lastly, working with the city HR department, we've expanded our outreach and engagement with diverse communities through job fairs and community events to promote more hiring of a more diverse workforce through inclusive hiring practices. I didn't mention all of the partners. You're getting a theme here. Partners involved in informing our work on reconciliation. So let me just do that, because we couldn't do it without them. There's the Ottawa Aboriginal Coalition, Wabano, Tunga Savingat Inuit, Akausavik, the Ottawa Inuit Children's Centre, certainly elders and the Kairos and the city's Aboriginal Working Group are key. So our last strategic priority, advancing a healthy public, to advance healthy public policy, this is where we worked with city bylaw, and you can tell we're still doing it on some of these subjects, legal, and the Council on Smoking and Health to look at gaps in smoke-free legislation and related to cannabis legislation. We were successful in getting prohibition of water pipes in public places and in workplaces. We also sought to influence municipal and provincial policies with respect to the built environment and, for example, working on the city's official plan to make sure that it guides healthy city development. And this is in partnership with the Planning Department. We also looked at reducing harms from gambling, which is a policy issue, and drawing on evidence from the Gambling Research Exchange, Ontario. And now we have 11 other organizations and members involved in a gambling prevention of harms network. The last policy area I want to highlight is working in the healthcare system. So we created sub-region healthcare profiles. Again, this was our epidemiology team working with the LIN and other health units in the Champlain area. And these profiles are being used to inform healthcare planning. So you can tell I've only highlighted some of the work. You've heard about more over the years, but I think these are highlights that show we've had an impact at the population level as well as delivered services that make a real difference in the lives of individual people. And I think you can also see that how we work stands out. That the work we do is always undertaken in partnership. That extends our impact and our message. And it is based on evidence as well as with attention to equity. So there's always much more to be done. We know that. We can see a lot of these initiatives continuing into the future, but we do want to take a moment to celebrate the successes. We need to recognize the accomplishments and not get too tired out by just going. I think pausing and celebrating is worthwhile. And so I want to thank you as the board for creating that strategic plan, giving us the direction of the areas to focus on, helping us with what initiatives we're likely to get us there. And I hope that you can celebrate with us the improved health of our population. And that's all I wanted to say in the presentation, but I'm happy to take questions.
Thank you very much, Dr. Etches. Any questions or comments? Member Lakin?
Yeah. Thank you for that review. And as I look back on what you were just saying, Dr. Etches, I remember thinking as we were doing this strat plan that it was ambitious and yet necessary, touching on the priorities that as a board we felt we needed to do at this time. Discussing the strat plan gives me pause to think about a couple of things in your review, and one is to highlight how in developing the strategic plan a lot of thought went into developing priorities, practices, and programs that were evidence-based. And we talk a lot about that around here and in developing these OPH's work. But I do want to highlight going forward how essential it is that we also have evidence to help us inform if we're making a difference as we're looking at our strat plan. And I appreciate that's a really difficult business to be in. But as we think next year about how to identify the next strategic plan, I'd like to challenge us to think about building into the strat plan a way to evaluate or think about when we do this again 5 years from now, how do we know if we've made a difference? Not just with our strat plan, but just as an operating agency, can we build a culture of evaluation into everything we do? As I know we think a lot about evidence as we decide on what to do. Can we do the same thing with, are we making a difference? So I want to just throw that down as an idea. number one. Number two, on a different point, I'm thinking about the members' comments earlier about cannabis and what we're doing on the file. One of the comments I wanted to make as I'm thinking about our strat plan is that while it is certainly a threat, it's also an opportunity. And an opportunity to translate some of the strategic objectives we have through the cannabis file. So we talk about promoting mental health, we talk about promoting healthy living, and so on. I'm not certain where we're going to be with our next strat plan, but the files have some economies inside them, and I'm hoping we can think about how to dovetail a couple of files so that we can kill two birds with one stone, if that makes sense to put it that way. So thank you for that, and that's the end of my comments.
Okay, if I may, I'll just respond to those points. I think it is absolutely in our minds. How will we talk about the next strategic plan 4 years from now? I want to reassure you that evaluation is something we do for all of our new initiatives. So, for example, the Good Foods Corner stores, we've evaluated that. The expansion of harm reduction services, we've evaluated that. So there are a lot of more micro evaluations that happen, and I think what we want to be able to do is roll that up and look at what we're learning at the strategic priority level, perhaps in a different way. So we'll take that. And on cannabis and the opportunity to promote mental health or find some economies between substance use and mental health, I think that is also thinking that the team is undertaking right now. Just do a little preview of something I think you'll see in the new year. We're looking at a mental health and substance use strategy together. So deliberately trying to think about those two subjects in more connection. So we'll keep consult on that. Thanks.
Member Chernyshenko.
Thank you very much. I just wanted to seize the occasion to say how gratifying it is to see the results. I suppose some detail to the strategic plan work that we did. We went through a number of planning sessions, and now to see how, in practical terms, that has borne out in the many different fields, to me certainly is very gratifying. I had the pleasure, the honor of, in my 2 terms in office, 8 years of serving on the Board of Health, and to have been able to be a part of setting the direction of the work that's done for a large and dedicated workforce has been a pleasure and an honor to me. Thank you.
Thank you very much. Anyone else? No, seeing no other comments or questions, can we carry the report from Dr. Etches? See, carried. Thank you. Okay, moving on, motion to adopt reports. Member Taylor, please.
Be it resolved that the verbal report by the Chair of the Board of Health, the verbal update by Dr. Vera Etches, Medical Officer of Health, and the reports titled Building a Healthier Ottawa, Ottawa Public Health Strategic Plan 2015-18, Final Report, Medical Officer of Health Submissions to the Province on the Smoke-Free Ontario Act 2017 and the Cannabis Act 2017 and 2019 Ottawa Board of Health meeting schedule be received and adopted.
Thank you. Sorry. Motions of which notice has been given previously, we have none. Motions requiring suspension of rules of procedure, again, we have none. Notice of motion for consideration subsequent meeting, and again, none at this time. Confirmation bylaw, Member Taylor, please.
Be it resolved, the confirmation bylaw number 2018-6, a bylaw of the Board of Health for the City of Ottawa Health Unit, to confirm the proceedings of the Ottawa Board of Health at its meeting of November 19, 2018, be read and passed. Is
that carried? Carried. Inquiries and answers, there are none at this time. And before I adjourn the meeting, I just want to say a couple of words. As most of you know, this will be my last meeting in terms of Board of Health, and not only for the Board of Health, but through for City Council also. What I do want to do this evening is personally thank each and every one of you for the support and for the excellent work that each and every one of you provide, not only to this board, but also in your day-to-day lives. And I'm speaking basically the public members of the board. I know that what the work councillors do on an ongoing basis in their communities and with their community partners. But it takes a lot of effort from some of our public members to not only raise their hands to perform this duty, but to do it so religiously and do it on a regular basis and have some very good input. And that's one thing I've really enjoyed chairing this board, is the input that we received throughout the meetings throughout the years. And that I really want to thank you for knowledgeable input and for input that made a difference, and for input that not only made a difference, but made us a viable entity in terms of the City of Ottawa. It was only a short time ago that we achieved the independence as a board, and I think that was a step well taken. And tonight, and over the last 3.5, 4 years, we've seen the work of that board. It's important for this board to not only do the work on a day-to-day basis, but also to look after the public's health, and which I think this board has done very admirably and will continue to do so on an ongoing basis. For those of you that may be thinking about reapplying and your positions are still available, I encourage you to come back and reapply, and if, again, your schedule allows. To my council colleagues, again, thank you for all your efforts on this board, as well as at City Council, representing your communities. I think all of the communities in this city are unique, and representation on this board obviously shows your passion and compassion towards your community. To Dr. Etches, I want to thank you for joining Ottawa Public Health and for the direction you've shown in your role as the Medical Officer of Health. Over the past few years, I've had a front row seat as you've managed public health crisis, from influenza to supervised injection services to opioid addictions and to mental health. Thank you for choosing public health as your profession. You continue to be a great asset to Ottawa, and we're fortunate to have you. I've learned a lot from you, from serving not only in this board, but the conversation we've had away from the board in the office on various topics and different partners and different services. I think this board made a wise choice in selecting somebody like you from in-house, and to have the capabilities of working together with the board and with City Council. So thank you, Dr. Etches, for your service. I also want to thank the three Associate Medical Officer of Health, Genevieve Katsu, Robin Taylor, and Munir Taha, for your support over the years, to Dr. Etches, as well as to Israel Levy. Jillian Conley, thank you for so much for your help with all the research and all the projects that you've handled through this term of board. You know, just a couple examples: the casino file, the opioid crisis. I mean, your research capabilities and performance is par excellence. Thank you. To Andrew Hendricks, your work is making Ottawa safer. Thank you for your important role in disease prevention. I know from day one we had some discussions, and I really valued those discussions with you and in the work that you perform in your day-to-day duties with the Ottawa Public Health. And one thing that became very visible to myself was your passion towards the role that you were assigned. And look at it today, with 4 or possibly 4 supervised injection services, or as they're going to be called, safe for consumption sites. So that's all work of you and your team for doing that. So thank you for that. To Doug Kirkpatrick and Eric Leclerc, thank you for your communication skills. Your essentials are to our mission. Your communication skills are essential. Thank you for getting the message out into the community and educating the public. Your words save lives. Without proper communication, most of the work that the rest of the team does behind the scene is visible, mind you, but still, communication is what makes it worthwhile to the public to understand and take it forward. So thank you. To our legal advisor, Omar Ansari, for keeping us on the right track throughout the meeting. So thank you for that. To Lou Flaberia, our financial advisor. I may have had a hard time, including tonight, pronouncing your last name, Lou, but one thing I did understand is the numbers that you provided, so thank you for that. To Esther Mogadam, Esther, thank you for your feedback, especially after the meetings. To me personally, I've always appreciated your commitment and appreciate the feedback that you provided me over the many years of service to this board, so thank you for that. Thank you to Ms. Blay. Dan, you made what I would call a smooth transition into this role. And over the last, almost 2 years, a little over 2 years, you did an excellent job. Not only doing your duties, but keeping me in line throughout these board meetings. So thank you for that. These labels on the microphone that most of you don't get to see, I have 2 labels here, which button to press when. So thank you for that kind of guidance. To our mayor, Jim Watson, for his support of the city, but more importantly of this board's work and for Ottawa Public Health's work. Without his commitment and the commitment of senior management team at the city, some of the work would have got done, but may not have gotten as noticed and as well informed to the public as it has been because of the support of the mayor and of our chief officer, Steve Kanalakis. So thank you for that. The one name sitting on my right-hand side that I haven't mentioned yet is Monica Stewart. Thank you, Monica, for joining us and supporting the team on an ongoing basis. Of course, I would be remiss if I didn't mention Israel Levy and his years of service to the Ottawa Public Health. I also would like to take this opportunity to the many members of the staff for Ottawa Public Health that I did not mention this evening by name, but I do appreciate your work and appreciate what you do day to day, hour to hour, minute by minute in the community and in the public. Sometimes those are some of the challenges that you face we don't even get to see because you resolve them before they even become challenges for the board. And I do want to thank each and every one of you, the inspectors, the nurses, the public health nurses, everyone that does the work day to day and keeps us online. So thank you for doing that. You have a challenging job. Protecting people's health is a challenging piece of work, and I do want to thank you for doing that. And the most important one in terms of the public health is the immunization records of our kids. We've come a long way. I mean, I remember a couple of years ago what the number was, an astronomical number of kids that weren't either immunized or weren't reported in. But thanks to the background work for everybody to get that number down and to continue to protect the health of our young people in the community. You think the work is done? No, it's not. Because there are many more challenges yet to come. Cannabis being just one of them. But I know that the future board will handle those well based on the leadership of this public health team, as well as not only the leadership on the public health team, but the staff that supports the leadership team of this public health. It is with compassionate people and passionate people that we work, and we work with our partners in the community for the same reason, because they're very compassionate towards the cause and towards the goal of keeping public safe. The one final thank you I want to provide to the gentleman in the back. I'm sorry I don't remember your name. He's the media person for us. He broadcasts our meeting every month, and thank you for bringing the message from the Public Board of Health out to the community via electronic medium. So thank you for that. And finally, I wish you all the greatest success in the future, and thank you for working with us. Thanks very much. So on
Mr.
that
Chair, this isn't a point of privilege, nor is it a point of information, but I did want to just make mention of the fact that you have mentioned every single one of the amazing Ottawa Public Health team, the senior management team, everybody throughout the organization, and all of us. The only person who didn't get an acknowledgement publicly in there was you. So thank you for your years of leadership, your chair, your steady chair of this board, and you're absolutely right. The work doesn't end. This is always a marathon. It's a relay race, but for the time that you were here carrying the torch, you held it high, and you made it a beacon for future chairs to look at. So thank you very much for all of your work.
Thank you very much, Mark. Thank you, everybody. And on that note, can we adjourn the meeting? Adjourn. Thank you. Thanks, everybody. Bye-bye.